on our minds as we look to the fall is what will COVID look like? Certainly what will influenza look like? But then what about all of the other respiratory viruses that aren't reported to public health, but we know can cause significant illness, especially among young children, or cause outbreaks in long-term care homes? So with this integrated respiratory virus approach, there's a number of key messages that, yes, are important for COVID-19, but also important for this all respiratory virus approach. And the first key message is for people to stay home if they're sick, and to stay home until it has been at least 24 hours since you've had a fever, and at least 24 hours that your symptoms have been improving. And if you happen to have had vomiting or diarrhea, that it's actually 48 hours that you stay home. And I think this is one of the most important messages, as we know often that people are their most infectious very early on in their period of illness. And that's across multiple respiratory viruses. Accompanied with that, and the second part of the message I think is equally as important, is that people wear a mask for 10 days after their symptoms started. So regardless of whether or not you tested for COVID, regardless of whether or not that test is positive or negative for COVID, the recommendation is still that you wear a mask for 10 days after your symptoms have started, and that you avoid settings where there are people at much higher risk of getting severe COVID. So that might be, routine visits to loved ones in long-term care homes or that sort of thing, to really be aware of trying to prevent any sort of spread onto those people that might be more vulnerable to severe infections. The next message really, or next key message is to be aware of what's going on, and to be aware of is COVID activity increasing? Is influenza activity increasing? Where are things at? And to support this, we are updating our dashboard on our website for COVID-19, and it should be going live with our next update next week, but we'll take also a more integrated respiratory approach so that people can see and be aware if we're seeing increased levels of COVID-19, to understand to bring those masks with you, so that if you're going to an indoor crowded setting, you have a mask available and can put it on. The fourth key message really is know whether or not you are eligible for treatment for COVID-19. There's a number of different antiviral treatments that are available. I think the most commonly talked about one is Paxlovid. But for those people at higher risk of severe illness, certainly be aware whether or not you're eligible for Paxlovid treatment, so that should you develop COVID-19, you're able to treat it quickly. I think the best way to know whether or not you're eligible, certainly there's different resources available, but the next time you're in speaking with your primary care provider at an appointment, to ask them whether or not you're eligible, and to ask the best way that you would be able to access it should you develop COVID-19. And finally, but certainly not least important, again, one of the most important is to stay up to date with vaccinations. And as we head into the fall season, really that's two-pronged. That's up to date with your COVID-19 vaccines and up to date with your influenza vaccines, as we know that the universal influenza immunization program is also rolling out this fall.